Is your baby crying for hours, and nothing seems to help? Tried everything: feeding, changing, rocking, and still, the tears don't stop. If this sounds familiar, you're not alone. Today, we're diving deep into baby colic. What it is, what causes it, and most importantly, how you can cope and care for your baby and yourself during this challenging phase. Welcome back, moms. If you're new here, make sure to hit that subscribe button so you don't miss any of our helpful tips on parenting, baby care, and everything in between. What is baby colic? Let's start by understanding what baby colic really is. Colic is a common condition where an otherwise healthy baby cries excessively and frequently, without any obvious reason. The medical definition often refers to crying that lasts more than 3 hours a day, for more than 3 days a week, for 3 weeks or longer. This usually starts in the first few weeks of life. It can be heartbreaking to watch your baby cry uncontrollably, especially when nothing you do seems to soothe them. But here's the good news: it's temporary, and your baby will outgrow it. Colic typically peaks around 6 weeks and gradually improves by the time your baby is 3 to 4 months old. What makes colic different from normal crying? Newborns cry, it's how they communicate. But with colic, the crying is more intense, more frequent, and unpredictable. It often starts in the late afternoon or evening and seems to follow no pattern. The baby might clench their fists, arch their back, turn red in the face, or pass gas frequently. And while most babies cry for 1 to 2 hours a day, colicky babies can cry for hours on end. What makes colic especially stressful is that it doesn't respond to the usual calming tricks. Feeding, rocking, changing diapers, it all might seem ineffective. But hang in there, mama, there's help. What causes colic? One of the most frustrating things about colic is that we still don't know exactly what causes it. But experts believe several factors may contribute, including 1. An underdeveloped digestive system. 2. Gas or indigestion. 3. Food sensitivities or allergies, especially in breastfed babies if the mother consumes dairy or other irritants. 4. Overstimulation from lights, sounds, or activity. 5. A developing nervous system adjusting to the world. 6. Family stress or maternal anxiety. 7. Exposure to tobacco smoke during pregnancy or after birth. It's important to remember that colic doesn't mean your baby is sick, and it doesn't mean you're doing something wrong. It's just a phase of early development, difficult, yes, but manageable with the right strategies. Signs and symptoms. Here's how to tell if your baby might have colic. Predictable crying episodes, often in the late afternoon or evening. Crying that seems like screaming or sounds like the baby is in pain. Clenched fists, stiff arms or legs, arched back, or tight abdomen. Trouble sleeping due to frequent crying. Fussiness that doesn't seem tied to hunger, dirty diapers, or being tired. If your baby shows any additional signs like fever, vomiting, or a rash, it's crucial to consult your pediatrician immediately to rule out any underlying conditions. When to see a doctor. Even though colic itself isn't harmful, it's always good to talk to your baby's doctor if you're unsure. Your pediatrician will do a full exam, check your baby's growth, listen to their heart and lungs, assess their reflexes, and make sure nothing else is causing the crying. Sometimes, additional tests might be suggested to rule out allergies, reflux, or infections, but more often than not, colic is diagnosed based on observation and your baby's medical history. Soothing strategies that work. Let's talk about practical, tried and true ways to soothe a colicky baby. Every baby is different, so some of these might work for you, and some may not, but don't give up. Trial and error is part of the journey. The 5S method by Dr. Harvey Karp. Swaddling. A snug wrap can mimic the womb and provide comfort. Side/stomach position. Hold your baby on their side or tummy, only while supervised. Shushing. Gentle white noise, like a vacuum or fan, can help calm your baby. Swinging. Gentle rocking or bouncing can recreate womb-like motion. Sucking. Offer a pacifier to soothe the urge to suck. Warm baths and tummy rubs. A warm bath can relax tense muscles. Follow it up with a gentle tummy massage using circular motions. This can also help relieve gas. Car rides or stroller walks. Many babies are lulled to sleep by the motion of a car or stroller. If you're exhausted, this can be a great way to calm your baby and get some fresh air yourself. Noise machines or lullabies. White noise machines or soft lullabies can help create a calming atmosphere. Changing feeding techniques. If you're breastfeeding, consider cutting out common allergens like dairy, soy, or caffeine for a week to see if there's any improvement. For formula-fed babies, ask your doctor if switching to a different type might help. Caring for yourself. Let's not forget about you, mom. Colic doesn't just affect the baby, it impacts the entire family. Endless crying can leave you feeling helpless, frustrated, and exhausted. Here are some wellness tips just for you. Take breaks. It's okay to put the baby in a safe place like the crib and step away for a few minutes to breathe. Ask for help. Don't be afraid to lean on your partner, friends, or family. Even a 30-minute break can make a world of difference. Talk to someone, whether it's a friend or a counselor. Talking about your feelings is a sign of strength, not weakness. Join a support group. Many moms go through this. Online forums, local mom groups, or parenting apps can connect you with others who understand exactly what you're going through. What not to do. There are a few things to avoid when your baby is crying. Never shake your baby. No matter how frustrated or overwhelmed you feel, always place the baby in a safe spot and take a break if needed. Shaken baby syndrome can be life-threatening. Don't overfeed. It might be tempting to offer more milk just to calm your baby, but overfeeding can actually worsen the discomfort. Avoid overstimulation. Bright lights, loud noises, and constant picking up and putting down can overwhelm a colicky baby. The good news here is the silver lining: colic doesn't last forever. By around 3 to 4 months, the crying spells usually ease off, and your baby becomes more alert, interactive, and content. This phase, though tough, is temporary. And many babies who experience colic go on to be calm, happy, and perfectly healthy. So, Mama, if you're in the thick of it right now, just remember, you're doing an incredible job. Colic is hard, but it doesn't define your parenting or your baby's future. Be kind to yourself. Stay patient. And know that relief is just around the corner. If this video gave you some clarity and comfort, please give it a thumbs up and share it with another mom who might need it. And if you want more baby care tips, real mom advice, and expert insights, don't forget to subscribe and turn on notifications so you never miss an update. Thanks for watching, and until next time, take care of yourself and those tiny little toes.